Falls are a leading cause of injury among older adults. Despite being common, they are preventable. Here to talk about simple fall prevention strategies is Dr. Paula Walker-King from Columbus State University. Good morning.
Good morning, Cheryl.
Nice to have you here.
Great to be here.
So tell us, why are falls more prevalent among older adults?
Well, literally, because of advancing age, there are physical changes that take place, as well as health conditions that develop, as well as the medications that are used to treat these conditions that contribute to an increased fall risk.
So to decrease your risk of falling, certain factors should be evaluated. What are they?
So the first thing we want to do is make sure we assess the medications and make sure that when we look at the medication list, there isn't a side effect of dizziness that's caused, because a lot of medications will cause dizziness.
Yes.
Some of them will cause excess drowsiness or sedation, making it more likely that a person will fall. The other thing is one assess vision. Sometimes it's just an updated eyeglass prescription or cataract removal that will allow a person to have better vision and minimize their chances of falling. And then other things that we want to do is just to make sure the blood pressure is regulated, because sometimes, have you ever had this notion where you sit down and then you stand up too quickly and you notice you have a little dizziness or lightheadedness? So we call that postural hypotension. So we want to check the blood pressure to make sure on a regular basis from sitting to standing to make sure that's not factoring into the fall risk.
Okay, so what else can be done to prevent falls?
The key thing we can do, Cheryl, is to exercise, to maintain an exercise regimen that improves our balance as well as our strength. Eat a healthy, well-balanced diet that's high in calcium and vitamin D. To keep the bones strong. We want to make sure our home is free of any type of hazards. For example, clutter increases our fall risk. A loose area rug, a draping cord, all of those contribute to fall risk. And then again, just having the vision and medications checked. Those are the 4 strategies that will help minimize falls.
Okay, and I know I had one at one time. It was a study, not a study, but a procedure done to check my bone.
Yes, it's a bone density test.
Bone density test.
And it is non-invasive.
Right.
It's a quick test that can be done, and it can actually tell you the strength of your bone. Because literally, a lot of falls happen because the bones actually break, and people collapse or fall as a result. So the bones break in midair.
So not the vice versa, not falling then breaking the bone and then falling.
That's right.
Okay,
yeah.
all right.
So bone density test, very simple test that can be done that can go a long way in preventing.
So talk to your doctor about that.
Talk to your doctor. Yep.
All right, great information always. Dr. Paula Walker-King from
Cheryl.
Columbus State University. We're going to send it over to Elizabeth D'Amore.
Thanks, guys. I wanted to talk about your